Okay, so welcome to Brain Behavior and Cognition. I'm the course director, the course coordinator, Mike Bradrick, and just going to do a quick kind of overview of what this course is going to look like. By now, you guys have probably gone through some of the pre-session self-study material. The goal of that was to really lay a foundation for basically neurology and the neuroanatomy. And by going through those rather large packets of material, you'll be ready to hit the first case or two with basically your feet on the floor and ready to go. So let's do a quick overview of this course. This is going to be 8 weeks long. Basically, it starts the first week of May and ends basically the last day of June. In total, there are 13 cases, 7 of which are going to be kind of your classic neuroscience / neurology cases, and then the final 6 will be psychiatry cases. Other kind of events that are of note is going to be the eye fair. So you guys be going into the eye clinic and learn some of the specific clinical tools and tests and analyses that you will do from basically practicing eye physicians. From the anatomy perspective, there are going to be 8 anatomy laboratories, 4 of which will occur in late April, and 4 labs will occur in early May. There are also several workshops, one of which is the cranial nerve lesion workshop. There's, I think, 2 neuroanatomy workshops, and there's also a sonographic anatomy workshop as well. Other things that are of note include patient presentations. We'll have at least one day, if not 2, where we have live patients come in and they can talk to you about basically how they live with their neurological disease. From a basic science perspective, the major disciplines in this course are going to be anatomy, neuroscience and neurology, pathology, of course pharmacology, and psychiatry. Other disciplines of note include genetics, immunology, microbiology, and histology where appropriate. And so the bulk of the cases are going to be really looking at diseases within the nervous system, and we're going to basically talk about the whole gamut of the neurological diseases that you'll see. Hopefully the approach in which these cases are laid out makes logical sense from both a structural but also a functional component. And then, of course, the latter part of the course is going to really focus on the mind. And it's going to be a little bit different in terms of patient histories, signs and symptoms, and so forth. We're going to kind of expand on the criteria of the DSM-5 and really get you acquainted with, how you should be approaching the management and the care of these patients. Okay, so some of the diseases that we're going to be talking about are going to be kind of your classic CNS diseases, stroke, Alzheimer's, epilepsy, MS, Parkinson's disease. Other diseases that are going to be kind of uniquely classified as cortical symptoms, aphasia, amnesia, depression, personality changes. Other symptoms that are really important include headache, pain, loss of different senses, and then the general complaint of weakness. And then uniquely basal ganglion type diseases, including anything from Parkinson's and Huntington's disease. And so these are the kind of diseases and symptoms and chief complaints that we're going to be dealing with throughout the block. From an assessment perspective, we're looking at, remember there's 13 cases, so there's going to be 13 CBCLs. There's going to be 2 clinical skills assessments, readiness assessments, I should say. There'll be 2 formatives, and the dates of which and the topics of which will be released later. This is to accommodate for any kind of shuffling around that might need to occur. And of course, there's anatomy and histology practical, And there's obviously the summative exam, which is at the end of the course, worth just shy of 60% of the total grade. So the neurological system, of course, is quite complex, and the kind of analysis of this can be challenging. And so to kind of help you unravel a patient's chief complaint, you're going to learn a variety of skills on the practitioner component of this block. And the first thing you're going to learn is the neurological exam. And we know that it can be pretty overwhelming, but you'll experience a lot of these tricks and tools in the trade via the expertise of the neurologist and the ophthalmologist here at Rush. And so the neurology faculty are going to be taking you through these neurological exams starting on May 8th. And please make sure to learn the content of this exam prior to that so that you can best optimize your time with these experts. You'll have 2 mastery labs following the faculty-led workshop, one for cranial nerves and the second for the rest of the neurological exam. Although the eye exam you are tested on is pretty rudimentary, you'll be spending some time with the eye doctors who will help you understand the anatomy and the pathophysiology of common eye complaints. This is always kind of a fun experience for students. They tend to enjoy it, and of course you get a lot out of it. As you move through the cases, you'll learn how to interpret individual pieces of the physical exam as you're faced with each patient complaint. You'll learn to integrate the anatomy and the neuropathology with clinical scenarios to help you identify problems and, of course, solutions. This block will also help you be introduced to the concept of hypothesis-driven physical exams. Your upperclassmen have designed workshops to help you understand how to plan your patient encounters so that you can use the clinical information you find in these exams to commit to a diagnosis. Building on what you've learned in previous blocks, you'll be able to create new illness scripts for these diseases that you're going to encounter. You'll be able to create problem representations to help you identify a set of differential diagnoses, and you'll be able to determine the next appropriate steps in patient management. And remember that the practitioner content really works kind of hand in hand with everything else you're learning. So you'll need communication skills, of course, to kind of gather these data and medical knowledge base to put this into some type of context, and a voice to advocate for the patients that you're going to be caring for. And later on, as we move into psychiatry, you'll learn how to assess a patient with a psychiatric complaint, or how to evaluate a patient that doesn't have a complaint, how to take a history, and what components of that history are important and why. I love this diagram, by the way. And of course, from the perspective of pharmacology, we'll go through all the medications that can be used to treat these neurological and psychiatric disorders. This is going to be a bit different, as many of the drugs do not fit into our typical baskets that we've been kind of organizing our drugs with. Many of these drugs have mixed selectivity to certain neurotransmitters, whether that be dopamine, norepinephrine, serotonin, etc. And many of the neurological and psychiatric diseases, the exact pathogenesis or the etiology is still largely unknown. And then to summarize, basically clinical skills content, we're looking at a combination of narrative reflections, physical exam mastery labs, and of course clinical skills assessments. And all this is also summarized in your syllabus. And finally, if you wish to contact me, my contact information is here. Please note that I'm not in the ACFAC building. I'm in a separate building. Here's a nice map. This is the Cone building. Here's ACFAC. Here's Harrison Street. Here's the POB building. Here's that Circle Drive, and it's basically kitty corner from Jelke. And so if you go down Harrison Street and you pass Wood Street, you've gone too far. Feel free to drop by, but please call beforehand because the building is secure. Not every student has access to this building. So I'd hate for you to come all the way down Harrison. Of course, it's summertime; it'll be warm, but you definitely would be best to call or email first. Okay, so thank you and enjoy this block. I know it's going to be a lot of work, but it's going to be a lot of fun as well. Thank you.